Hello everyone, and welcome to our NUR2106 group presentation on kidney stones. My name is Sarah, and I'll be explaining to you the pathophysiology of kidney stones.
Hi, my name is Sheree, and I'll be discussing the pharmacological interventions.
Hi, my name is Kayla.
And my name is Nikki.
And we'll both be discussing the nursing management of patients with kidney stones.
Let me introduce to you our patient. Randell is a male, 63 years old, and is married. He works as a farmer on a rural remote property. Randell presented to the ED with severe right flank pain that rated 9 out of 10 on the pain scale. He's also experiencing nausea and has vomited twice in the last couple of hours. After conducting a patient health history assessment, we found out that Randell has hypertension, tachycardia, type 2 diabetes, is obese with a BMI of 32, had a calcium oxalate stone approximately 2 years ago, a family history of calcium stones, including his father and twin brother, and that he has no allergies. Randell had his vital signs tested. His blood pressure is 145/92, heart rate of 112, respiratory rate 28, temperature 37, and oxygen saturation 98.
Hi, I'm Sarah, and I'm going to explain the pathophysiology of kidney stones, which are also commonly referred to as nephrolithiasis or renal calculi. The pathophysiology of kidney stones is still largely misunderstood, but generally abnormalities in the renal functioning are seen and play a part in their formation. I'm specifically going to be discussing the pathophysiology of calcium oxalate kidney stones, as that is what our patient Randell has been diagnosed with. Calcium oxalate kidney stones are the most commonly experienced stones, and several things assist in the formation. So one, the supersaturation of insoluble compounds, abnormal pH of the urine, and low urine volume. So supersaturation of the insoluble compounds, so calcium oxalate stones form when there's an excessive amount of the ions calcium and oxalate. This happens when they're excreted in the urine, which then attach to one another to form a nidus for stone growth. The supersaturation of calcium and oxalate in the urine may be due to several of Randell's risk factors, and these include a high protein diet, as animal protein is broken down into oxalate and uric acid. Oxalate combines with calcium to become calcium oxalate, and the uric acid aids in the nucleation of the calcium oxalate compound into crystals, which can eventuate into a stone. Low urine volume. A low urine volume means there's less liquid to dilute the ions to prevent crystallization. Hence, a low urine volume directly contributes to the supersaturation of ions such as calcium, oxalate, and uric acid. His family history and personal history. Studies have shown that people are likely to develop a stone if an immediate family member has experienced kidney stones, and similarly, once an individual has experienced a stone, a reoccurrence is very much likely to happen. An abnormal pH of the urine. Well, the pH of the urine is an important factor, as both alkaline and alkalotic levels can be an ideal environment for the development of kidney stones. When the pH of the urine becomes unstable, the levels of free-form uric acid can increase, which assists in the nucleation process of calcium oxalate kidney stones. And low urine volume. As mentioned before, the level of urine produced directly impacts the levels of ions that are available to nucleate. Therefore, it could be said that Randell's lifestyle has likely contributed to the development of his condition, and simple modifications that he could make to reduce the recurrence of stones include increasing his daily water intake and decreasing the amount of protein he consumes. It is believed that a papillary calcification is the nidus for many calcium oxalate stones, and these are called Randell's plaques. They are composed of calcium phosphate and allow adherence of the calcium oxalate crystals and subsequent stone growth. When the stones becomes large, it may detach and move throughout the kidney, aggravating the sensitive urothelium and causing damage. This is most likely why Randell is experiencing flank pain, as the muscles of the ureters are contracting in an attempt to pass the loose stone, which is large enough to be irritating the urothelium. Most stones can be passed naturally, but if large enough can cause extensive damage and may require urgent intervention. Possible complications that Randell may face with being diagnosed with a calcium oxalate stone include complete obstruction of a ureter, which could lead to damage of the kidney and infection, destruction of the nephrons, sepsis, and end-stage renal disease. Kidney stones also increase an individual's risk of coronary artery disease, chronic kidney disease, and stroke.
I'm Sheree and I will now discuss the pharmacological interventions. Pharmacological treatment for kidney stones vary, depending on the type of stone and the cause. In Randell's case, his kidney stones have been identified as calcium oxalate stones, which he has experienced previously. Like Randell, overweight patients with hypertension and diabetes have all been shown to be associated with an increased risk of stone disease. Randell may be given medication to help pass the kidney stones. This type of medication, known as an alpha blocker, relaxes the muscles in your ureter, helping you pass the kidney stone more quickly and with less pain. An alpha blocker increases the spontaneity of the passage and shortens the duration of the passage. This medication is indicated because Randell needs to pass the kidney stone. Some side effects that Randell would need to be aware of include urinary frequency, incontinence, dizziness, nasal stuffiness, and hypotension. This medication would be contraindicated if Randell had hypertensivity or hepatic and renal impairment to the drug. Some safety measures that the nurse working with Randell could include would be monitoring the patient for adverse reactions and patient education about the potential side effects. NSAIDs, or acute pain relievers, include passing a small stone can cause some discomfort. To relieve acute pain, Randell will be provided with pain medication as a priority. This medication is indicated for the relief of Randell's pain and discomfort. Side effects that Randell may experience are nausea, GI pain, constipation, dizziness. This medication would be contraindicated if Randell had allergies, peptic ulcers, GI bleeding, or hypertension. Safety measures to take into consideration include ensuring Randell takes the medication with food and maintaining an elimination record. Thiazide diuretics. Ideal for preventing calcium phosphate type stones and calcium oxalate stones. They can prevent the former because they lower calcium phosphate supersaturation via both reduction of urine calcium excretion and urine pH. Thiazide diuretics enhance renal calcium absorption in the proximal and distal renal tubule and thus have been the mainstay of treatment of calcium oxalate kidney stones. Dietary prescription, especially restriction of sodium intake, should be continued when thiazides are prescribed in order to maximise the hypocalciuric effect and limit potassium wasting. Potassium supplementation, either potassium citrate or chloride, may be needed when thiazide therapy is employed. This medication is indicated as Randell has recurring kidney stones. Some common side effects that can be experienced are dizziness, nausea, vertigo, vomiting, dry mouth, or muscle cramps. This medication would be contraindicated if Randell has allergies, fluid or electrolyte imbalances, or severe renal disease. Safety measures to be considered would include monitoring and educating Randell on the possible side effects. Potassium citrate therapy is associated with reduced risk of recurrent calcium stones in patients with low or low normal 24-hour urinary citrate excretion. Calcium stone forming patients with normal citrate excretion but low urinary pH may also benefit from citrate therapy. Thiazides and potassium citrate therapy have been shown to prevent recurrent stones in patients with normal range urinary calcium and citrate respectively. Therefore, it may be appropriate to utilise these therapies for patients with recurrent stones who do not demonstrate specific urinary abnormalities such as Randell. This medication is indicated due to Randell's calcium oxalate kidney stones. Some common side effects are abdominal discomfort, vomiting, diarrhea, or nausea. This medication should be contraindicated if Randell has hyperkalemia, chronic renal failure, or uncontrolled diabetes. Safety measures to be considered are ensuring Randell takes medication with food and to increase his intake of fruits and vegetables and to reduce sodium intake.
An important nursing intervention involves performing a focus assessment. It is vital that a nurse performs an assessment for Randell upon admission, and this involves a health history, physical examination, and investigation. This aims to confirm the diagnosis and associated causes, as well as building a therapeutic relationship with Randell. The admission nurse would have completed a health history for Randell, which includes previous and current medical conditions, medications and supplements, dietary habits and lifestyle factors that predispose to kidney disease, as well as conducting a physical examination. The nurse will also need to assess Randell for pain and discomfort, which includes the severity, location, duration and frequency of the pain. The purpose of doing this is to identify any pain which will allow the nurse to establish an effective treatment plan. Through doing this, the nurse finds out that Randell has severe right flank pain and is scoring his pain a 9 out of 10 on a numerical rating scale. Ongoing assessments will need to take place for the continuing care of Randell to detect infection or a decline in his condition. This can involve conducting further tests and examinations, such as urinalysis and imagery techniques such as bladder ultrasounds and CT scans. The urinalysis provides essential clinical information on kidney function and helps to diagnose other diseases. Urine culture should be obtained to rule out urinary tract infection if urinalysis is abnormal or if there is a history of recurrent UTIs. Bladder ultrasounds are a non-invasive tool that measures urine volume in the bladder. The scan head is placed on the lower abdominal of the patient and is directed towards the pubis and bladder. The device automatically calculates and displays an estimated urine volume, and portable battery-operated devices are available for convenient bedside use. Additionally, CT scans and MRIs are also non-invasive techniques that provide great cross-sectional views of the kidney and urinary tract and are used to evaluate many conditions including kidney stone disease.
Acute pain management. Randell must be assessed for pain and discomfort as well as associated symptoms such as nausea and vomiting. Initial management should focus on alleviation of severe renal colic, which is accomplished with the administration of non-steroidal anti-inflammatory drugs, also known as NSAIDs. NSAIDs, for example, ketorolac, the analgesia of choice for pain management in patients suffering with acute renal colic. It is also important to note that opioid analgesic agents such as morphine may be prescribed to provide rapid relief alongside NSAIDs if they alone are not effective. Antiemetic treatment should also be considered in tandem with analgesia to manage and control the patient's nausea and vomiting. Farrell and Dempsey highlight the importance of monitoring Randell's pain level closely, and if there is an increased severity, it must be reported promptly to the doctor so that relief can be provided and additional treatment initiated. The nursing team can prepare Randell for further treatment such as lithotripsy, ureteroscopy, or surgery. Surgical intervention may be required if the stones are too large to pass spontaneously, if they cause acute renal obstruction, if they are located in a site with a potential for complications, or if the patient shows persistent symptoms without evidence that they are passing. Pain is an unpleasant phenomenon that is uniquely experienced by each individual. It cannot be adequately defined, identified, or measured by an observer. It is crucial for the nursing team to listen to Randell about his pain levels because McCaffrey quoted in 1968 and is still used today, "Pain is what the person experiencing it says it is, exists when and where he or she says it does. The patient is the authority about their own pain, and therefore it must be managed accordingly."
Referral to allied health services is an important nursing intervention for patients like Randell who are experiencing kidney stones, as it involves a more detailed and specialised management of the condition. Some patients like Randell require a more comprehensive metabolic evaluation, which is generally undertaken by a urologist with a specific interest in kidney stones or a specialised renal stone clinic. Randell Rock is experiencing recurrent kidney stones, has a strong family history of kidney stones, which includes his father and twin brother, and also has poor health, which is indicated by his BMI, type 2 diabetes, tachycardia, and poor diet. Taking these indications into account for the management of Randell's condition, highlights that Randell will need an immediate referral to a neurologist. This will then focus on Randell's symptoms, allowing for more precise patient-centred care. A dietitian plays a vital role in caring for patients with kidney stones, and referral is imperative as they provide specific dietary advice on foods to minimise and increase causes of kidney stones and will implement a therapeutic diet to prevent reoccurrence. Dietary assessment is very important both in treating and preventing stone formation and can include a 24-hour recall, food record dietary history, and a food frequency questionnaire. The dietitian will also need to evaluate Randell's dietary intakes of calcium, oxalate, sodium, protein, dietary supplements, and fluid intake, as these can either promote or inhibit stone formation. The information gathered from the dietary assessments will allow the dietitian to assess nutritional risk factors and provide recommendations to Randell based on these risks. Obesity is also a major risk factor for kidney stone formation and can contribute to reoccurrence. Randell Rock is obese and has type 2 diabetes, which are conditions associated with kidney stones. With regular exercise, he is likely to lose weight, which will reduce the likelihood of recurrent kidney stones. Referral to a personal trainer will provide Randell with guidance, and an exercise program will be implemented around Randell's lifestyle.
Nutritional therapy and fluid intake management. Diet and poor fluid intake significantly influence the formation of kidney stones. Patients who present with kidney stones, in the case of Randell Rock calcium oxalate stones, most often require fluid administration. Farrell and Dempsey emphasise the extreme importance of Randell Rock increasing his fluid intake to produce a urine volume of 2.5 litres a day to prevent dehydration and promote excretion of the kidney stone. If patients are unable to obtain adequate fluids orally, IV fluids are prescribed to increase the urine volume and facilitate the passing of the stone. It is important Randell is advised to drink more water when exercising and during hot weather or working in warm environments. It is crucial care is taken to manage and monitor Randell Rock's fluids because patients suffering from kidney stones often have limited or restricted ability to urinate due to urinary obstruction. In conjunction with increased fluid intake, a fluid balance chart may be commenced. This monitors Randell's fluid input and output in order to prevent dehydration, as this is a major risk factor that precipitates stone formation in patients predisposed to kidney stones. Randell must aim to reduce the concentration of oxalate and calcium in his urine, which can be achieved through the following dietary guidelines related to protein, sodium, and oxalate. He must limit excessive protein and foods high in oxalate in his diet, as this can increase both calcium and oxalate in his urine. Randell must reduce the consumption of sodium in his diet, as too much can result in a higher volume of calcium in his urine, and he must also avoid vitamin C supplements, as these can increase levels of oxalate. Teaching patient self-care. Prior to Randell being discharged, it is of high importance for the nurse to teach appropriate patient self-care. This involves educating Randell of the risks of recurring kidney stones, causes of kidney stones, and ways to prevent their return. It is important the nurse ensures Randell understands the factors that increase the risk of recurrence of kidney stones and strategies to reduce these risks. Due to the high risk of stones returning, Randell must be aware of the signs and symptoms of stone formation, obstruction, and infection, and the importance of reporting these symptoms promptly.
Discharge planning is also a very important nursing intervention, which aims to reduce hospital length of stay and unplanned readmission to hospital. It also focuses on providing a smooth pathway between hospital and place of discharge. Discharge planning needs to be effective as it underpins safe and effective healthcare, and communication between the community and hospital professionals is critical in doing this. Randell's discharge should include a multidisciplinary team giving clear and precise summaries of key information such as medications and ultimate patient outcomes. Randell's wife should be included in the decision-making, and both should be provided with relevant contact numbers. The discharge team needs to make sure Randell is aware of his referrals and that he has continuous follow-up.
Hi, this is Sheree again, and I'll now discuss the National Safety and Quality Health Service standards that are relevant to our presentation. Number 3, preventing and controlling healthcare-associated infections, which describe the systems and strategies to prevent infection of patients within the healthcare system and to manage infections effectively when they occur to minimise the consequences. This is directly related to our case, as effectively managing Randell's condition will prevent the opportunity of the kidney stone leading to an infection. Similarly, hand hygiene should always be encouraged when attending to Randell. Number 4, medication safety, which describes the systems and strategies to ensure clinicians safely prescribe, dispense and administer appropriate medicines to informed patients. Utilising the 7 rights of administration when giving Randell his medication ensures Randell is receiving the right drug at the right time for the right reason. They are right dose, right patient, right time, right route, right document, right reason and right drug. Number 5, patient identification and procedure matching, which describes the systems and strategies to identify patients and correctly match their identity with the correct treatment. Always ensure Randell's identification is matched up to his chart, medication documents and wristband before treating to ensure you have the right patient.
That concludes our group presentation on kidney stones. Thank you so much for watching.